Hi folks, I am Congressman Jared Huffman. I believe we are now live with this town hall, and I want to thank all of you for joining me. I want to also thank you for the incredible engagement that we have had in the days leading up to this town hall from my constituents. We have literally received hundreds of excellent questions in advance, and that's going to get us started with a great conversation today. So thanks also to the many media outlets and partners who are helping us broadcast this program today to reach as many people as possible throughout my congressional district. Obviously, getting this COVID pandemic under control is going to require months of additional work. It's going to require more sacrifice and lots of good decisions by all of us. But one thing that is increasingly on everyone's mind, certainly judging by the feedback I'm getting, the calls, emails, and letters to my office, is vaccines. I am hearing everything from basic questions about safety and efficacy to questions about supplies and distribution plans, equity concerns, eligibility and timing questions, and a lot more. So today we have convened a panel with the smartest public health experts that I could find in the North Bay to answer as many of these questions as possible and bring us all up to speed. My staff has been sorting the questions that we've already received into themes, and so we will do that to try to cover as many bases as possible. And then we'll try our best to also include questions that will be coming in from those of you that are joining us on Facebook Live today. So go ahead, if you're with us on Facebook, fire away with your questions, and we'll try to work those into the mix. Some of the information that we're going to cover today, I think, will be broadly applicable to anyone in my district and beyond. But the particular focus of today's town hall is Marin and Sonoma County. We're going to have a second town hall next week on February 3rd that will focus more on vaccine issues in the northern counties in my district, Mendocino, Humboldt, Trinity, and Del Norte. But today, the North Bay will be our focus, and I will now introduce our outstanding panelists, and then we'll dive in to the questions. So first, I'm happy to welcome Dr. Robert Rodriguez. I won't tell you all about his incredible academic pedigree, but it includes Harvard Medical School and a residency at UCLA, a fellowship at Stanford. He's currently, though, at the UCSF Hospital, one of our nation's foremost healthcare institutions. He's an associate chair of research, professor of emergency medicine, and he practices in the emergency department and ICU. And last year, when a terrible COVID outbreak swept through Brownsville, Texas, Dr. Rodriguez went there because it's his hometown, and he volunteered to help. And that experience, as well as the research that he's been doing on the impact of COVID, on the mental health of frontline providers, have made Dr. Rodriguez a very sought-after advisor at the national level. He's done that for the Congressional Hispanic Caucus, and most recently, he was selected as a member of the Biden-Harris Transition Team and their COVID Advisory Board. He is currently leading national studies to address the issue of COVID-19 vaccine hesitancy. We'll have some questions about that today. And also COVID-19 induced post-traumatic stress disorder, or PTSD. So Dr. Rodriguez, welcome. We're honored to have you with us. And then I also have two more familiar faces to those that have been in my online office hours and town halls. They are the respective top public health officers for Marin and Sonoma counties. They also have fantastic academic backgrounds and professional qualifications. And that is Dr. Matt Willis from Marin County and Dr. Sundari Mase from Sonoma County. Welcome again to each of you. So I'll get us started just by observing that we're only 9 days in to the new Biden-Harris administration, and yet I have already seen, as a congressman, just dramatic changes in the way our federal government is approaching this pandemic, starting with the team that President Biden has put in place, then including his first executive actions and his clear, consistent messaging on this. Yesterday, I participated in a Zoom meeting with our new COVID czar, Jeff Zients, along with Dr. Fauci and other members of President Biden's team. And there's just no question that controlling this pandemic so that we can save lives and get this economy out of the ditch is right now this administration's very highest priority. They are bringing unfiltered science strategic planning, transparency, and accountability to this crisis. We've been missing all of those things. And instead of just talking about it like it's a war, they're treating it like it's a war that we intend to win, having experts rather than politicians call the shots. No radio personalities advising top health officials here. We are utilizing the Defense Production Act, which is something I've been calling for months. We are deploying FEMA and National Guard resources. All of this is a very refreshing change from my perspective. The Biden 100-day plan is not all about vaccines. There are mask orders for federal property, for airplanes and airports, and on trains and buses. But really the heart of this plan is a major push to try to vaccinate over 1 million people a day during this first 100 days. And that requires several things. It requires first securing enough supply of vaccines. And so you've already seen the new administration exercising contractual options and doing other things, working, we hope, to bring new vaccines online very soon, and talking about using the Defense Production Act where necessary, even to bring on new pharmaceutical manufacturing capacity. It's going to require plans and investments in having more places to administer these vaccines. And so FEMA and our National Guard are coming into the mix. You're going to see federal vaccination centers, including mobile centers for rural areas. We need more people to administer these vaccines. And so we've already seen Health and Human Services begin to relax rules so that folks can cross state lines and not get hung up on the various state bureaucracies that would otherwise slow down the approvals for them to help. And then finally, it's not enough to just hit this ambitious goal in the next 100 days. There is a very clear focus on trying to address equity as we do it. COVID has exposed terrible health disparities that exist for a variety of reasons, and we know that the impacts of COVID have been greater in communities of color and disadvantaged communities. So as we try to achieve these targets, there's a real focus on addressing equity along the way. And so you're going to see community health centers brought into the mix to try to help with that. Indian health clinics as well. And I'm pleased to see that priority. So we're just 9 days in. Obviously, a lot of details are still missing. This information is fluid. I don't know if our state and local partners have yet seen the impact of this new team and the new direction. I'll be interested to hear what Dr. Mase and Dr. Willis have to say about that. But I am confident that in the days ahead, all of us are going to see the difference. My staff and I are tracking these federal actions as they roll out. We will continue to do our best to share details with you as we learn more. One last thing. Congress has recently put billions of dollars in additional funding on the table as a down payment for all of this, and I will be working to support President Biden with his new American Rescue Plan. You've probably heard about this. This is a big $1.9 trillion emergency legislative package, and we need to do that, I believe, to finish the job. Okay, I'm going to kick off the question and answer period, and again, we'll start with the questions that we have already received in advance. I'll direct these questions to certain of our three panelists, but all of you are welcome to jump in if you want to add to what each other has to say. And if you want to ask each other questions along the way, that's just fine with me as well. All right, overwhelmingly, the majority of questions we are getting are from people who want to know where to get the shot. So let's start with a brief status report from our county public health officers in Marin and Sonoma. To just tee that up, one of the questions I'm getting, for example, a constituent named Warren is asking, what's our goal at the county level? And, you know, the usual, when can I get my shot and where? So why don't we start with you, Dr. Willis?
Yeah, thank you for that question. I'll start by sharing, if I can share my screen, our website where people can go ahead and register where they might. Screen?
I think so.
So this is our dashboard in Marin County for vaccinations. This shows the number of people we vaccinated since about 6 weeks ago. We first received our first doses. We're about 26, almost 27,000 now. This is updated daily. We vaccinated about 9% of our population. The light blue is the first dose and the dark blue is the second dose. And this is where the majority of people who have been vaccinated in Marin and will continue to be vaccinated are covered at our mass vaccination site, which is the Marin Center. It's where the fair, the county fair, you may be familiar with this giant indoor operation, really well suited to a socially distanced mass vaccination experience. We're able to move about 1,200 people through on a daily basis, 3 every minute, and we've been doing that now for the past 3 weeks at this site. This is how people can learn more about when they are due. Obviously, as Congressman Huffman said, by far the limiting factor in our ability to vaccinate our community is the supply of the vaccine itself. And so we are now in the process of just teeing up our population, teeing up our community so people know when they may be due. We'd like them to go ahead and register on this link. It's our vaccine interest form. We have about 40,000 of our residents now have already used this, and we encourage everyone to go ahead to our website, coronavirus.marinhhs.org, and enter information about yourself. It's a simple form to fill out. It's your name, it's contact information, your age, any characteristics regarding any medical conditions you may have, and then whether or not you might need assistance getting to the facility or needing assistance moving through the facility in terms of the ability to walk through that environment. And then when your time is due, based on the information you've entered, we will reach back to you with the information that you've provided us to let you know that this group is coming online, and we'll send at that time all of the information regarding where you can get an appointment at that time. We know that there's going to be more and more options becoming available over time. So as we move into the months, we'll have more options we can share with you. This is also then the question, how do I get an appointment? So anyone who wants to know how they can actually schedule an appointment can go to this tab on our website, and it shows for the current time, and will be continuously updated, where appointments are being offered. In Marin right now, it's for our residents age 75 and older, and our healthcare workers, our phase 1A, just the very tail end of that group. We've almost moved entirely through that group, but we're now opening it up to our residents age 75 and older. Kaiser Permanente, Sutter Health, Marin Health Hospital, and Public Health are all offering vaccinations for those age 75 and above. And you can find appointments here. Unfortunately, the appointments are very limited, but this is where you can schedule appointments through our website. I'm just going to end my introduction piece with this. This was the view from my office just a few days ago as we were setting up the point of dispensing site in the canal area of San Rafael, that neighborhood that was so hard hit, our Latinx essential workers, as we were setting up a site that now is able to vaccinate 400 people from within that community each day. And I think it speaks for itself in terms of the hope we're all experiencing as we bring the vaccine into our communities.
And Dr. Willis, thank you. Did you want to touch on what the Marin County goal is for vaccination, and how long at this point you think it's going to take for us to reach that goal?
Our goal is to vaccinate. It's really up to. I would put that back to, we will vaccinate as quickly as we get doses. Our goal is to never be the rate limiting factor in terms of our own operations, our own ability to move. Our goal is that the pace that we're able to move is determined almost entirely by the doses we receive. We have 800 clinicians who are ready to go as volunteers. We've got multiple sites set up, teed up, ready to move. So our goal would be to move as quickly as doses allow. We're hoping that we can do our 500,000 vaccines. That's what we're going to need to cover our entire community of 250,000 people with 2 doses by the end of June, doses allowing.
All right, very good. And in terms of the when can I get my shot, I mean, you've provided as much of that as you can, but until we get more doses, you really can't answer that for most people, right?
Right. I mean, we're right now age 75 and above. We have 23,000 residents age 75 and above, and we're about 20% of the way through that population. And then we'll be moving to 65 to age 74. And that's another 30,000 residents in that group, obviously selecting those groups because they are at highest risk for bad outcomes should they become infected. And that's, depending on supply, that's probably to the end of February before we're able to move into other groups.
Okay, thank you. Dr. Mase, let's go to Sonoma County.
Great. Thank you so much, Congressman Huffman. I would also like to. Great. One second. It says that I'm not able to screen share at this time.
You should be able to.
Okay, hang on one second. Okay. So I want to share a few slides to show where we are with the vaccine rollout first, and then share my dashboard as well. But just one sec. Okay, can you see that all right now? Okay, great. Let me state that we actually have, as of today, reached about 40,000 doses administered as of January 29th. And as you can see, we've sort of ramped up vaccine administration over time significantly. Of that, about 24,000 people have gotten a first dose, and the rest have got 2 doses. And over time, as you can see, we've really built up our vaccine operations. With through January 4th, we had only vaccinated 1,000 people, and then as you can see, exponentially over the weeks, we've begun to vaccinate more and more people with our health partners. As you know, Sonoma County doesn't have its own clinic infrastructure, so we're really working through our healthcare partners. That's our federally qualified health centers, our hospitals, and volunteers, the Sonoma County Medical Association, et cetera, to really get this done and trying to reach the most vulnerable populations as quickly as possible. As of now, fully vaccinated residents, we have about 7,000 people that have been vaccinated. And you can see what the age groups are and distribution by sex as well. And again, we are trying to reach our most vulnerable populations and are focusing our efforts, as Dr. Willis said as well, on people who are in that over 75 and over category, and our Latinx that are very heavily impacted. We will be replicating a dashboard shortly showing what every different institution in our county is doing in terms of the numbers of persons who have received a first dose, second dose, fully vaccinated, appointments, et cetera. And I think that is really important for us to provide information for the community. So we're very lucky that we have gotten an OptumServe site. That is a state-run vaccination site. We're one of 4 counties that are in a pilot program. This is in Rohnert Park, started on Wednesday, has been fully booked up. We'll be able to provide 400 vaccinations a day. And we are limiting that right now to those people aged 75 and up for the same reasons that Dr. Willis explained. We also have had our AMR, that is our paramedics and fire agencies that perform clinics. Sonoma County Medical Association has really jumped in, doing about 500 vaccinations a day for our phase 1A, tiers 2 and 3, healthcare providers and et cetera that are still needed to be vaccinated. There aren't that many people left in phase 1A, but they're completing those. A Safeway clinic, which will be starting for age 75 and above next week. A private group clinical health appraisals, which is also supplying vaccine for the public health field workers through the county. DEMA has been fantastic. That's a disaster emergency management organization that now is targeting the Latinx 75 and older and very specific populations, about 300 vaccines a day that they're able to perform. And then we have a few other different options. And Santa Rosa Fairgrounds is up and running with several lanes with Safeway, Walgreens, and other partners vaccinating there as well. So I'm going to go to our dashboard and show you what we have up. And let's see if I can find that. Just one sec. There we go. Similar to Marin's, you can go to socoemergency.org. You can get data on what our cumulative vaccinations are. And as I said, we're going to try to put up more data by institution shortly. You can see where we are in terms of the distribution plan, get information about the different phases and tiers. And then you can click on, again, these particular icons and find out when you can expect to get your vaccine, and then find out different information about the vaccine, the benefits, safety, et cetera, key facts. And our real strategy here, let me stop sharing, just to answer the question that you'd asked, Dr. Willis, is to target those people that are most vulnerable. So again, we are reaching out people who are 75 and above first, and then we'll go to people who are 65 to 74. We plan to get through these groups probably by end of February, as Dr. Willis had said. Now keep in mind in Sonoma County, we have 500,000 population, 36,000 people who are 75 and above, and 102,000, or 20% of our population, that falls in the 65 and above category. So we're first reaching out to those people who are disabled, at home, receiving in-home supportive services, 75 and over, and our Latinx community through our partners to reach the most vulnerable populations. And then we're just going to march through the groups as quickly as we can, our goal being, again, to try to provide vaccination for everybody who wants to be vaccinated by the summer.
All right, well, thank you both very much. I want to turn now to a question for Dr. Rodriguez. Actually, a couple of questions that have come in. One is about the different vaccines and considerations for choosing among them. I think we got news today that we have a third vaccine from Johnson & Johnson now in the mix with some of its own trade-offs. And then questions about the new variant, which is very much in the news today. We know about the UK variant in South America, but the one that Dr. Fauci was most concerned about when I spoke with him yesterday was this South African variant, and some in vitro evidence that our existing vaccines aren't nearly as effective against it. The Johnson & Johnson vaccine apparently was tested in South Africa and also had a decline in efficacy. So, Dr. Rodriguez, what can you tell us about some of those considerations and the new variants?
Yeah, thank you. Thank you, Congressman Huffman. I'm happy to be here. It's a great panel, and again, really happy to be here. Starting with the issue about the vaccines, the choices of vaccines. Yes, the Johnson & Johnson vaccine was just results from that data are out now, and it while it doesn't have the level of efficacy that the other two vaccines have, the Moderna and the Pfizer vaccine, it's still very effective, and it's most effective, 85% effective in terms of preventing severe disease, which is really the primary endpoint, the primary thing that we want to prevent. Again, when you look at it, it's still within the range of the other two vaccines, which were above 90, slightly above 90% effective in that regard, and it still should be effective. So I don't think that we should have any concerns about turning to that vaccine if it indeed does get distributed. I think that it will be very effective, and we should not consider it to be a poor alternative. I think it'll work.
So even though you're hearing numbers in the 60% range for efficacy, which sounds a lot inferior, you're saying for the severe disease it actually performed.
In terms of like moderate or less severe illness, it had lower efficacy. But again, that's still a highly effective vaccine. When we consider it in comparison to traditional influenza vaccines, which can range, their efficacy can range from the 40 to 60% range, it's still a very effective vaccine. So again, I don't think that it should be considered as a weak alternative.
Terrific.
With regard to the variants, yes, there are a number of variants that are sprouting up across the world. You noted the South African variant and these other variants, and that is a concern. There is a concern certainly about some of the variants being more infective, having higher transmission rates, and but those the variants that we've looked at so far, it appears that the current vaccines, should be effective for most of them, other than the last one that you mentioned. It's too early. There's basically not enough data right now to determine whether that in vitro loss of effect translate into in vivo effect, loss of effect. So in other words, like while in the test tube in a lab, the vaccine may not show the degree of efficacy. Oftentimes, when you put it into patients, there can be much higher rates of effectiveness. So I think it's too early to tell that we should worry about our vaccines not being effective. What I do think, the long-term picture, however, is that with these new variants that are arising, we're probably setting the stage for a situation in which we will probably have to have yearly vaccines, perhaps yearly COVID-19 vaccines, to address the various variants that are arising. So it's looking more and more like we may be in a situation where we're giving yearly COVID-19 vaccines, just like we do influenza vaccines.
Yeah. What we do about this concern on variants, some people might hear about this. It sounds, kind of ominous, and they may decide, well, gosh, maybe I won't get vaccinated until we have a vaccine that covers the new variant. Dr. Fauci made a really important point yesterday, which was the best thing you can do if you want to prevent this variant problem from getting out of control is to get vaccinated now, because the less the virus spreads, the less chance it has to mutate. Would you agree with that, people that are afraid when they hear the news of the variant should still get the vaccine?
I 100% agree with Dr. Fauci. He's like the god of vaccines and this particular issue. But it absolutely it indicates a call for having more people vaccinated. The more people that get vaccinated, the less virus there is around and to mutate. So it's a sheer statistical issue in which the fewer viruses, fewer people who are infected with the virus, and the fewer load of virus there is in the community, in the world at large, the less there is of that, the less chance there.
Vaccine question that I've gotten from Jane. She's talking about the assumption out there that a lot of people think if they get vaccinated, they don't have to continue to wear these and do the other things. So what do we know about the type of protection that you get when you get vaccinated, and what kind of ongoing behaviors and practices are still going to be with us even as we begin to hit our vaccination goals?
Yes, the absolute basic message here is that you have to continue to use those measures. We have to continue wearing masks. We have to continue considering social distancing. We can't let our guard down. We don't know. Most of the vaccine trials have not really looked at infectivity, infectivity of others. Which arises to a large degree from in the nose and the nasopharynx portion of the body. So it's not clear that vaccines, that the vaccines that we have now completely eliminate the chance of transmission to other people. And for that reason, we need to continue protecting ourselves and others with masks and social distancing. We should not let our guard down. For example, I mean, we as frontline providers, I had my vaccine, I believe it was December 19th. I work at San Francisco General, and all of our frontline providers were immunized within the next 3 weeks. We absolutely continue our usual procedures of N95 masks, face shields. We have not relaxed our measures at all. So I have a very strong recommendation that people continue to wear masks.
All right. Thanks, Dr. Rodriguez. I have more questions for our Marin and Sonoma health officers, but Jenny, did you have some from Facebook Live you want to throw in?
Yes, I do. A number of people are asking about when children will be vaccinated and if there are any clinical trials for children under 18 years of age.
All right. Dr. Rodriguez, you want to answer about clinical trials with children, and then we'll go to our Marin and Sonoma public health officers to find out where children fit into their planning?
Yes. So there are a number of trials that are including children, and we expect results of that to start coming in, I would say, within the next 3 months. But until that time, there's not too much data on kids.
All right. Sundari, Matt, do you want to talk about where children can fit into our plans?
Yeah, I think we just have to wait for the clinical trials to make sure that we have a vaccine that's effective and safe in kids. And as soon as we get that information, then they'll be prioritized along our phases. As you know, kids haven't seemed to really have terrible outcomes from COVID, so in all likelihood, they'll be in the last phase.
Anything to add, Matt?
Same for Marin.
Okay.
Yes, same.
Great. Hey, this isn't about kids. It's about.
I would add. Sorry, I would add to that while we don't have a lot of data yet on kids, I fully expect it to be effective, and there's no reason to think that their biology should be different than adults. And so, again, while we don't have complete data yet, fully expect it to be extremely effective and is ultimately going to be recommended.
Okay.
And I can add that sequentially by age, and then adding occupations that are at highest risk among those adults that were part of those trials, so we know the safety and efficacy. At that point, our community as a whole will be so well protected, say June, before the studies actually show safety in children. We already know our children are going to start having that protection already because the rest of the community will be so highly vaccinated by that point.
It isn't about children, but one of my constituents, Betty, asks about a young adult with developmental disabilities. And I understand that at the state level, the recommendation is for developmentally disabled adults to be in Tier 1C, which is, a few phases later. And Betty makes the point that there are a lot of special considerations that make it harder for developmentally disabled adults to do some of the precautions that we've talked about, to understand a lot of the things that we want to be asking them about. Is there any consideration of moving developmentally disabled persons, especially with autism and cognitive delays, up a little faster in the prioritization?
Well, that's for, we at the county level, we are following the state recommendations, which follow from the ACIP recommendations at the CDC level. And that's where as you mentioned, that's where those individuals with maybe higher risk based on their medical conditions or other conditions have been classified in that tier 3. I think the state right now is doing a sort of a holistic review of the entire framework and strategy. It is admittedly complex and has been difficult to navigate, especially in the setting of real limitations in the supply. And I would expect that might change, but we don't have any specific knowledge of when that would change. We don't have, unfortunately, a lot of control over those decisions at the local level between tiers. We can decide at the local level within a tier how we might want to prioritize a population, but not moving people from later tiers into higher tiers, except for very unusual circumstances, like if you're running out of doses at the end of the day, or you have too many doses left over at the end of the day, you're able to invite people who are in lower tier status to come in to get vaccinated, because if the alternative is wasting that vaccine, but we're not able to reclassify people in terms of our strategy.
Short of a situation where your power goes out and because of refrigeration, you're about to lose a bunch of vaccines, so you open it up. Short of something like that, you cannot deviate from the state's tier hierarchy. Is that correct?
That's right.
Yeah, same here for Sonoma.
All right. Thanks. So Matt, the question from Paul has to do with just how confused a lot of people are, and I hear a lot of this too. We're told that seniors 75 and over are the current eligible group right now, and yet everybody knows someone who is over 75 and has diabetes or is a cancer survivor, and somehow is being told that they can't yet get the vaccine. What can you say to folks with elderly parents or relatives that are just not finding a way to get them in the queue?
Yes, well, speaking for Marin, it's just a simple matter of supply. This coming week, we have a total of 500 doses per day between Kaiser, Sutter Hospital, and Public Health, and we supply doses to Marin General Hospital. 500 per day for the entire population for new doses. We have to remember that every person that's been vaccinated in the past needs to have that second dose. So the majority of our allocation, right now just comes to vaccinating those healthcare workers that were vaccinated 3 and 4 weeks ago. So the remainder for us is such a small amount that the message, unfortunately, is one of patience. We are vaccinating as many people as we can each day from that group that we have identified as the priority, age 75 plus. We have 23,000 members of our community in that age group. And if we have 500 doses to offer each day, not everyone's going to get in at the same time. So it's just a matter of a queue, and we will get to you. And those appointments are being made available. Kaiser's getting more doses next week. Kaiser's going to have a lot more doses than they had last week. So we are making progress. And again, it's just a matter of waiting for the doses to become available. We will get to everyone.
Dr. Mase is not jumping in, but I assume it's a pretty similar answer for Sonoma County. Another Facebook Live question came in about teachers. So what can you tell us about when we might be vaccinating all of our teachers? Obviously, a really important thing to get our schools open safely.
Yeah, well, we really think that it's very important to get teachers vaccinated for that very reason. We're prioritizing people who are 75 or older right now. And so therefore we are holding off on anyone younger than 75, because as Dr. Willis has said, it really depends on vaccine supply. And we really want to get that vaccine to the people who are having the worst outcomes to try to prevent hospitalizations, deaths, and really try to mitigate negative outcomes from COVID. So we're hoping in the next couple of weeks that we will move to all of our teachers who are 65 and older, and then subsequently be able to offer the vaccine to people under 65, again, as we prioritize vaccine for all different groups in the same manner, starting with 75 and older.
Can I just offer a statistic that helped, I think, help our community understand why we have decided to focus on age 75 plus? For Marin County, based on our death rates by age, A vaccine offered to someone age 75 or greater is 332 times more likely to save a life than a vaccine that is offered to someone under age 50. And when you look at numbers like that, it's really hard to justify prioritizing any other group. 80% of our deaths in Marin County are among people age 75 or greater. And because we have such a limited supply, that's the rationale. And we hope that holds, for people to understand, at least for the next few weeks as we build up more supply.
Thank you. It sounds from both counties like until we get more supply, people are going to continue to be frustrated by not knowing where they stand in the queue and not understanding when they might be able to get their shot. So let's turn to that. I talked earlier about the efforts this new administration is trying to bring to this. They've said they want to give all of their state and local partners a 3-week advance window of where these vaccines are, when it's coming. We haven't had that in the past. I remember just a few weeks ago we had Alex Azar talking about a national inventory that just a couple days later he had to acknowledge doesn't even exist. And so I don't think you've had that kind of forward-looking transparency. Are you seeing any of that yet? And do you expect that to be a game changer for you?
Yes. No and yes. So we're not seeing that yet, but it will be a game changer for sure. We find out on Wednesday of the doses that will be received the following Monday, and we immediately, as soon as that Wednesday arrives, we schedule as many appointments as we have doses into the following week. So we're really living paycheck to paycheck. All of our systems are in place. Sometimes you're in the national news that what we need is more vaccinators or other. That's not our issue. Our issue is doses. We've got plenty of people to vaccinate. We have everything else in place. What we need is doses. And we only find out on Wednesday whether or not you're going to get anything from 0 to 7,000 on the following week. It makes planning really challenging, and I think it does contribute to some of that global frustration people may feel about where they might fit in the queue. So even if we can't magically produce more doses under the new administration, we don't expect that, the Biden administration found coffers of boxes of vaccine. We do hope that and feel hopeful that there will be at least more clarity in terms of the process so we can plan better.
Yeah, I would just second what Dr. Willis said. We haven't seen too many changes on the ground. We're still also living paycheck to paycheck, albeit we are getting more doses, I think, per population. Because our population is double Marin, still the vaccine is the limiting factor. The one thing that has kind of loosened up is the fact that we got that OptumServe state-run site for vaccinating, and it's a huge relief to have the state come in and provide that service. We're providing the Roanoke Park Community Center, and the state's coming in and doing all the work. We're helping with scheduling our vulnerable 75 and older. I don't think that's a reflection of what's happening in the federal level, but we're really looking forward to more such relief coming from the federal government.
Set aside $1.2 billion and said we're going to start to see federal vaccination centers, including mobile ones. Do either of your counties have any expectation of getting any of that, or do we just not know yet?
We don't know, but we certainly would love to have that come our way. And as I said, it will be a huge sigh of relief for the community when we see that kind of assistance coming to help us in our efforts. We have really geared up. We've been so fortunate to have hundreds of volunteers step up, different organizations, that it's sort of like cobbling the whole thing together, and it'll be really nice to have that kind of relief.
Yeah, I think a mobile option, for Marin and Sonoma, we share a common characteristics in terms of our coastal, more rural areas. And so a federal mobile option for our coastal communities would be really desirable.
And since we work very closely with Marin, we would love to do that, in conjunction with our surrounding counties, Marin and Sonoma.
So on equity, the idea of a drive-through vaccination site sounds great. We've been doing that for testing, but a lot of people don't have cars. And so I think mobile, I'm going to try to be a squeaky wheel and get some of those mobile vaccination centers out our way. Let's go to Dr. Rodriguez. So a couple more questions about when to get the vaccine. This one is about people who've had a positive coronavirus test but no symptoms. this person is getting some confusing guidance on how long they would need to wait to get a vaccine and how much that would complicate the immunity from it. And then I'll go ahead and put a second similar question out about efficacy. One of my constituents, Patty, asks, when you hear 95% efficacy, what does that mean? Does it mean that out of 100 people, 5 people get the coronavirus, or does it mean that no 5% risk? A little confusion about that, if you could clarify.
Yeah, so starting with the people who've had a COVID infection and either recently or very recently or in the past, the indications to get a COVID-19 vaccine remain the same. You certainly, if you're in a particular age group, when you come up or when you're offered the vaccine, you certainly should accept it. As to exactly when, like let's say if you've had COVID within a week or two, it probably does not make sense to do it at that point. I would say at least wait approximately a month or so. There is the only time that you absolutely should not get the COVID vaccine after infection is you should not get it within a month if you received a monoclonal antibody. If you happen to get one of the monoclonal antibodies, you should, the monoclonal antibodies can bind to the basically your production of immunoglobulins, your inherent production of immunoglobulins. So that particular group should wait approximately a month. But that's going to be a very small group of patients who get those monoclonal antibodies. And in terms of efficacy, the way to think about it is its efficacy in compared to not receiving a COVID-19 vaccination. If you were exposed to it, basically, if you took 100 people that were going to get, let's say you took 100 people in a placebo group and compared them to 100 people in the vaccine group, the group that got the vaccine are 1 in 20, basically, of them would get the COVID infection. Basically, 20 times more people would get a COVID infection who had not gotten the vaccine. It's a little confusing, but it's not. You have to compare it to like how many people actually wind up getting COVID-19. So it basically decreases your likelihood of getting COVID-19 by about 20-fold.
I think the confusion is, does that mean that 5 people out of 100 just didn't have the right reaction to the vaccine and got no protection, or does it mean every one of the 100 had a 90?
Yeah, it means that it involves both of those. Some people don't develop an adequate immune response, and that would be the majority of the people that of that 5% that sort of fail. And also, it's kind of a matter of statistics, because when you do a trial like this of the COVID-19 vaccine, you take all comers and who wind up getting COVID-19, and there will be a small subgroup who get it within like the first 7 days of being immunized. They wind up that they've been exposed like immediately prior to the vaccine, and so the vaccine your immune response hasn't had a chance to develop to prevent that in that first 7 days. So a large number of those patients occur in that first 7 days of having received the vaccine. I don't know if that clarifies it.
Well, it sounds to me like all of this is splitting hairs, that you're saying that these vaccines are just overwhelmingly safe and effective for everyone, and we should all get them as soon as we can. So that's my takeaway.
Yeah. Those of us in public health were amazed. I mean, it's really miraculous that this vaccine didn't exist. I mean, we just learned about this virus a year ago. We already have a vaccine that's way more effective than almost any other vaccine we have, to diseases that have been around for a long time. So this mRNA technology is just, 95% effective, is like off the charts effective with regards to vaccines. I'm just, you step back and think, wow, a year ago, we were just learning about this virus and we already have one of the most effective vaccines we've ever had. I think that's that's the story as far as I'm concerned.
Okay. Well, I wouldn't be fair if I didn't include some anti-vaxxer questions that we have been getting, so I'm going to put those out for any of you that want to try to field them. This first constituent says, if 80% of people who get COVID-19 have little to no symptoms, 90% of those who do contract symptoms recover just fine, and 80% of people injected with a genetically engineered, never before used experimental vaccine have a strong reaction. Again, these are his statements, not mine. I don't think that's actually factual. I guess the question is, he is asking, why are we protecting our citizens from a disease that has less risk than the vaccine? So that is one question critical of vaccine I'll put out there. The other one that I've gotten has to do with treatments versus vaccine, and this constituent suggests that there are a whole bunch of treatments that for some reason have not been approved, including one that this radiologist person is championing. And why are we focusing on vaccine when there's all these safe treatments that can fix the problem? So I put those out to make sure that we are addressing some of the.
So I would like to address vaccine hesitancy, which is a huge issue across the country. As many as approximately 40 to 50% of people in the U.S. are vaccine hesitant. In other words, they're either are declining the vaccine or they are hesitant. They're not quite sure about it. We've been looking into that issue, and when I say we, a group of investigators across the country have been looking at that issue at 15 sites across the country, and we found that the main reasons that people talk about are concerns about safety of the vaccine, side effects, as well as sort of what the other questioner asked about, like if this disease is not so severe. I would just put it very simply that from an odds standpoint, these vaccines we have a lot of data now on the safety and efficacy of these vaccines, worldwide, a ton of data now, and they've been shown to be extremely safe. The chances of a severe reaction are exceedingly rare. And so if you put it just from a straight statistical, simple messaging standpoint, your odds of having a problem with COVID-19 are, without a vaccine, your odds of getting sick are in the hundreds of times more likely than if you get a vaccine. So, your problem with if you're considering your overall chances of maintaining your health, it's hundreds of times more likely that you should accept the vaccine. They're extremely safe, and there's really no science behind not accepting the vaccine.
It's true that 80% of people are some significant fraction are mildly symptomatic or asymptomatic. The problem is you never know which group you're going to fall into. And that's one of the mysteries of COVID-19 is that otherwise healthy people can have really severe disease and pass away, and other people who are frail. I mean, we've had 100-year-olds seem to do just fine. And so, it's a gamble, right? I mean, you're really, everyone who gets infected with COVID-19 is potentially at risk of that ICU admission and even death. And we've seen that across all age groups. And we have a vaccine that's effective. The response that that's being described is your immune system. It's a predictable response, something that's stimulating your immune system to protect you in the future. That's what those vaccine responses really are.
Okay, and
And I can just add that you can be asymptomatic and you can be fine, but you can transmit this to other people who are not going to be fine and could get really sick, could get hospitalized, and even die. So it's sort of protecting yourself, your family, the community, and as I believe others have said, it's an extremely safe vaccine. And there is really no reason not to take this vaccine.
I think I know the answer to the last part that was, why don't we just go all in on therapeutics instead of, if I'm nervous about vaccines, it's kind of to your point, Dr. Mase, that if we did that, we would continue to spread this virus all over the place, and a certain percentage of people are going to continue to get very sick and die. Is that fair to say?
Well, yes, an ounce of prevention, that is worth a pound of cure, I should say. And also, we don't have a lot of proven treatments for COVID-19.
Yeah, I echo those points. And I've on the front lines in the emergency department in the ICU, I've seen a lot of 20, 30, and 40-year-olds wind up in the ICU on a ventilator and unfortunately die. So it is, as Dr. Willis said, very unpredictable, and you have to think about not only your care of your health care, but those around you. And so, yeah, and we are also looking at therapeutics, but as Dr. Mase said, there are not a lot of good options out there right now. They're very, very limited.
What are some Facebook Live questions from Jenny here?
Okay, and for a time check, we're right around 5 o'clock, but I hope people will stay for a couple longer minutes because this is a theme that has been brought up both on the Facebook and on the advanced questions, and that theme's about masks.
All right, let's hope our panelists can stay for just a few more minutes, and we'll try to get through a couple here.
Yeah, so people are asking, they can't get the vaccine right now, so in the meantime with masks, they're hearing different information, and they want simple advice. Should they be wearing 2 masks? What are the best masks?
Yeah.
Can the government help with the Defense Production Act so we don't run out of PPE? So maybe each of you, including the congressman, could comment on the strategy why we wait for vaccines.
Well, let me start because I am a bad congressman. I left without my N95 mask today, and I have what is one of these blue surgical masks, and I am told that a simple cloth mask might intercept 50 to 60% of the aerosols that I'm breathing out. This guy right here takes that up to 70 or 80, but N95 gets you 95. And if I put one of these on top of the N95, it's pretty close to 100. So I need to model that, that highest platinum standard of masking, but let me have the professionals correct anything that I just screwed up about that.
Yeah, I mean, I think that the hesitation is due to the fact that this is changing so quickly. And the CDC, we looked in public health at the local level. I looked at the CDC to guide me in terms of the recommendations I offer. The CDC has not yet changed its guidance for the public regarding mask wearing. We know that cloth masks, that paper masks as long as there's 2-ply, and one mask generally has 2-ply, are incredibly effective as a public health measure for preventing the transmission of COVID-19 at the population level. That is our fundamental tool. And if there's any other confusion about masks, let's not forget that that's really always true. And what we're talking about is nuances around that, whether you should double mask, in what situations might you wear an N95 or not. Those are details that we are still waiting to find the final answer around from the CDC, but let's not lose sight of the fundamental reality that covering your face when you're out in public, the way we have been doing all along as the way to flatten the curve, still remains our most effective tool.
And if I can just add, any facial covering, whether it's cloth, whether it's a surgical mask, is going to be effective. And it is such an easy intervention. I would recommend, as we are recommending through the different guidances and orders, that whenever you're out of your household with non-household members, you actually do wear a mask. And in fact, there's a study that shows that even within a household, if one person were to mask, there's a 77% reduction in transmission of COVID in the event that COVID is an issue and could be transmitted. Now, I also just want to say with N95s that they are a scarce resource. And again, we could come to a shortage of these very important PPE devices for our healthcare providers. So I wouldn't actually recommend that everybody go out and get N95s and wear them. They're also difficult to wear and quite uncomfortable. So just a cloth face covering, a normal paper surgical covering, those are all fine, I think.
Yeah, I agree. I think I would keep it simple. Just always wear a mask. And if you happen, and if it's not difficult for you to have a second mask on one on top of the other, if that doesn't bother you, yeah, sure, you go ahead and do that. But don't be freaked out that you're not double masking, and just as long as you do have some sort of mask, that makes sense.
Much as you can. All right, last question, I think, and then we'll wrap this up. Go ahead, Jenny.
Okay, and for a closing question, a number of people want to know what the chances are of the $1.9 trillion ledge package for the American Recovery Act. What are its chances of success?
So that is a very tough question, and it's all about politics, and it's mostly about the United States Senate. So what I would tell you this, I think because President Biden's Rescue Act is really comprehensive and includes almost all of the elements that many of my colleagues feel are necessary, we can pass it out of the House. I'm confident of that. I think we might even be able to pass it with at least some bipartisan support. The question is when you get over to the Senate and whether they're going to hang on to the filibuster rule, which would require 60 votes just to get it to the floor. If they do, it's going to be very hard to pass the entire package out of the Senate anytime soon. And so what you'll see if they hang on to that filibuster rule, which looks like they might, is you're going to see an effort to use a little mechanism we call budget reconciliation. It is a parliamentary device where we pass a budget resolution, and that, if we can legislate within the four corners of that, you can get to a floor vote in the United States Senate without a filibuster, and that means 50 votes is enough. And the effort, I think, would be to try to push as much of President Biden's Rescue Act into a budget resolution and a reconciliation device as possible. Some of it, because of parliamentary rules and germaneness, will fall out, and just you can't fit it in there. But a lot of it can probably fit in that way as well. And there's some really high-level negotiations way above my pay grade underway right now about which of those two paths this will take. But know that we are starting work on this right now. We are going to start the hearings, and the only question is whether it moves through budget reconciliation or whether we figure out a way to move it as more conventional legislation through the Senate. And I believe that's going to happen literally in the next 2 or 3 weeks. So stay tuned. With that, I want to thank our 3 fantastic experts who joined us today. Thanks to all my constituents for great questions. I know we didn't get to everything, but we will do more of these. And for those present. We're going to do one next week. I'll be joined by Assemblymember Jim Wood, as well as county public health experts. Jim Wood, of course, chairs the Health Committee in the State Assembly, so he's got a very important perspective on a lot of this. And I hope you'll join us. That'll be on February 3rd at 4 p.m. You can go to my website, huffman.house.gov, for information about any of this, and I hope you will sign up for our newsletter so that you'll get invitations about future town halls and other events that we think you will like. Thanks again, everyone, for joining us. We will see you next time. Stay safe.